Hey, this is our intervention session, talking about what we did. So, do we each want to just go over what we talked, like what we did for ours, or do we want to? How do we want to do it? Do we each want to do like all 3 questions, or do we just want to do 1 question at a time?
So, like for you and me, Rachel, like for our thing, we could both kind of trade off on that since we get together. And Samantha might have to just go over their group.
Okay, yeah, because then the first one, it says like each member briefly describe your physical and cognitive intervention assignment from 1 and 2. So if your partner from the assignment is present, you can do it together.
Yeah.
So.
Okay. So I guess.
Start?
Sure. So you want me to kind of go over ours a little bit and then you can.
Yeah.
Okay. Awesome. So for our group, we did helping your toddler learn to focus. And it was just like an average child learning how to focus. It didn't necessarily have like any disability. And some of the risks that we talked about were trouble following instructions, poor eye contact, forgetfulness, restlessness, interrupting or not listening, being easily distracted, the inability to follow through on tasks, and differences in child temperament. And then most children struggle with this, which is why it was a topic that we picked. And so some of the tools to be able to help children learn how to focus better, understand tasks, is to do shorter sentences and commands. Because when you talk and go on, they're not going to comprehend and understand what you're saying. So when you're like short with them, then they get what you're saying. Joint play, which is where you just spend time one-on-one with them and helping them focus using toys and different things to help maintain their attention. Helping them expand their vocabulary, so each time you play with them using new words, be able to help them to be able to better understand those around them, because they lose focus if they don't understand. Make sure you give them breaks. Children can only focus for so long. And so if you expect them to sit there and listen to you for a half an hour, it's not going to happen. Relate what they're learning to their interests. So if your kid likes cars and you're trying to learn how to count, you can like have them count cars or things like that. Get on your level when you're talking to them so you can maintain eye contact, use visuals, and set up a reward system. So that was kind of our identifying risks and intervention tools. I don't know if you want to go over the last little bit, Rachel. Or...
Sure. And then we talked about like how parents can face these challenges and what they can do if they're like struggling, basically. And like for me as a preschool teacher, I have this like every day, because your like whole goal is to like maintain their focus for like 10 minutes max, and just like getting them involved and just like being patient with whatever they're doing, trying to like help them find interest in it, because if they're interested in it, they'll be able to like focus on it more, and they'll actually want to be there instead of just like they're making me do this again, why? So, and then like finding what is like important to each child and seeing if like maybe you can implement that somehow, and just like putting that time in to get to know the child and know what they struggle with, or what they could like where their ability is at, because you don't want to push them too far where they're not going to be able to succeed. So being able to like have reasonable expectations for them and stuff like that. We also talked about like the ecosystems that are involved in it. So I thought that the microsystem, I think that was kind of like a interesting question, because I feel like all the systems have to be involved because they all play a part in like how a child is raised. But the system that you can like change the most, or that child can change the most, or like the parents, is the microsystem, because that's like what you have the most control of. Because the further you get away, the less control you have. Like the macro system, you barely have any control of like the laws and values and cultures of like the country you're in. It's just like set. That's what it is. And so like you can only really change you. And so that's where like parents come in the way that they communicate to the children, but also realizing that like their children affect them. So like that there's like a back and forth between the two of them. Yeah, and like making sure that that relationship's good so that both of them are working together, kind of thing. Yeah, that's really what I had. It was really cool though, because this is something that like I see every day, and so it was interesting to like see how I'd help parents with this, because I do talk to parents about it, like because they'll be like, oh, my kid doesn't pay attention to me, or what do you do to like make them stay focused, and these are like things that I would do. So I'd be like, oh, you should try this, or like how we implement like learning or letters or reading and stuff like that is into like games and stuff like that, so that the children are actually like interested in it instead of like flashcards with words on it. What is this? What is this? So yeah, it's kind of cool. But
Okay.
Yeah. So Samantha, what'd you do?
Okay, I have a confession to make. I didn't really do this assignment because I've been so stressed and saying like what, because you know, being an on-campus student and having to take an online class, it can get really stressful for me. So I didn't really have time to do it, but I did choose a topic and everything and decided to interview someone about it.
Weren't you in Amy's group for this assignment?
Oh yeah, I was.
This is the group one.
Yeah, it was.
This is the group one. So I'm sorry. Amy.
Yeah, hold on. Yeah, hold on a sec. Actually, let me get this. Let me get this all set up, like the PowerPoint, because I have it.
I even have it because I was supposed to be in your guys' group. So.
But I have it, so I'll talk about it in just a minute. But one thing I wanted to talk about with intervening, because I felt like this can be something good to talk about, is intervening when children, if they're like maybe struggling with something. I mean, like for me personally, I shared this today as well in one of my last class of the semester on campus. But sorry, this is going to be hard for me to say because it's kind of emotional. So I talk about how when I was 2 years old, I was not talking. I could not talk. I was a complete mute toddler who could not say anything. Like literally, I could not say anything at all. And my parents didn't really notice it too much. They didn't really think too much of it. They were like, oh, whatever. Maybe she'll come around to it. But then my grandpa was getting so concerned about it. Like he thought it was just really weird that here I am, 2 years old, and completely mute. So he intervened and said, you should check in and see if she needs speech therapy. You should be seeing if she needs any help. And my parents just kept blowing him off, and they're like, oh, whatever. No, we'll get her to talk. And a couple of weeks later, they weren't doing it. They weren't trying to get me to talk, and then like they were trying, but nothing was working. And finally, he did it one more time. He told them, get her checked out. So they did, and it turns out I was behind. So I immediately got put in speech therapy, and then within a couple of weeks, I was talking. But I felt like, and that's a good example of intervening, because I felt like, you know, when we intervene with kids, it's just like, it can really lead to really good outcomes. Like if we want to help them and everything with what they're struggling with, especially at that young age. But so our group, we did it about obesity. I think that's what it was. I think, for lesson 13, obesity in children from ages 6 to 11. And we went over about what it is, how to be more aware, and like even reasons. Like this is really interesting. So some of the reasons why children are becoming more obese is because of their behavior, the environment that they're in, genetics and everything, and even medical conditions and medications. And some of these examples about how these reasons are, especially like right here, like I have the PowerPoint right here to help me so I can reference it, is that with their behavior, spending a lot of time in front of their television or computer and spending less time outside or participating in physical activities, that's one of the main reasons why children are becoming more obese in terms of behavioral. And three of the things we talked about, like that we can use for obesity, is that we can educate parents and their children about nutrition and health, like educate them about it, like why it's important for them to have a good nutrition. And then also exercising and having programs that are nutritional, that can really help evolve. That's definitely a good intervention. And then the one that I really like the most is the intervention about how we can set limits on junk food and electronics and other stuff. I mean, I really feel like those are really good examples of what we can use to intervene, especially with this and everything. I'm sorry if I'm not making much sense. It's just that it's been a crazy couple of weeks. And it's just really interesting. Like another thing we did talk about was the challenges that come with obesity. And I remember putting this as how children who are obese, there will be not only challenges, but risk factors. And some of them include not only health problems, but bullying. They'll have difficulty in school, emotional and psychological problems, and even low self-esteem. So that's really interesting. And then last but not least, we even gave some tips about like how to, like with your child, like if you pack them their lunch for school, here are some tips that you should definitely try to do. Like one of the best things is it says give them enough food to keep them full, but just don't overdo it. And it also one of the biggest ones is I mean, this is something my mom always did, was have healthy snacks ready after school for when they get hungry. I mean, that was a struggle growing up. My mom saying, when I asked my mom, well, what can I have for a snack? She was like, oh, you can have fruit. And it's like, I don't want fruit. I want a cookie, or I want candy. I don't want fruit. Like, I hated that so much. But then over time, I realized the reason why was because she wanted us to be able to have fruit, and then if we were able to, and also with dessert, is that sometimes she would ask us, well, did you have fruit today? If you had fruit today, then yes, you can have dessert. But if you didn't, no dessert. And it's like, why? Like, it was such a funny thing growing up. But these days, I realize, yeah, this is important. I mean, and then with vegetables, the other funny thing is that vegetables, you know, every kid, we always see examples of kids not wanting to eat their vegetables. Some kids don't like their carrots. Some kids don't like their green beans. But I mean, the funny thing for me personally about this whole thing is how my parents literally said growing up, I had a problem with fruit, but I never had a problem with eating my vegetables. If we had like carrots with our dinner that night, I never had a problem eating them. And now I love all vegetables, and now I'm trying to help that with my nieces, because one of them loves her junk food. She's always wanting candy. But when I babysit her, I'm becoming like my mom and telling her, nope, you're going to have fruit instead. And then she ends up enjoying it. She's like, wait, this is actually really good. I mean, especially if you put peanut butter. I mean, kids love peanut butter with their celery sticks or apple slices. But, I mean, obesity is it's a really hard thing to talk about, in my opinion. But I feel like, especially if we really take the time to do this, we can really help children who are obese to not become super obese, or to even prevent it for them to be happening. And this is a really cool quote from a picture from our PowerPoint, but it says, education can be an antidote to childhood obesity. So yeah. Did that make much sense?
No, you're good. Yeah.
Okay, good.
Okay, so we can move on then. So then the next thing is describe your social and emotional domain intervention that you researched this week. State whether you have actually implemented the intervention personally to address the identified problem. If so, discuss how effective the intervention was. If not, discuss research or other evidence assessing the effectiveness of the intervention. I can start if you want.
Okay.
So I did self-regulation or like inability to self-regulate was the first problem that I did. I see this at the preschool I work at all the time. It's seriously like every child that walks in like can't control like their emotions, or they haven't learned how to just like let it go. Just like it's okay. They just
it's that's tough. It is tough.
Yeah. So the intervention that we teach them at the center is deep breathing, and it's like a coping mechanism kind of thing, like learning those. So basically, it's like they get like we'll talk to them about like identifying what feelings they're having, because you never want to like have their feelings like not matter. Like you don't need to cry about it, don't worry about it kind of thing. It's more of like, how are you feeling right now? I want to be able to talk to you so I can know what happened kind of thing, instead of like shutting down how they're feeling. You're still addressing how they're feeling, but you're allowing them to realize they can feel that way without like having to cry about it, or being able to like realize what they need to do next. Like even if they do cry, they can like calm themselves down and then like go get a teacher to help them solve the problem or something like that. So we have them either do like, for some of my kids, I just like say it for them. I'll be like, in through your nose, out through your mouth. And like they'll like go from like not being able to talk to me to just like, and it's the funniest thing ever, because they're just like, they've been like, they're like teaching all of them to be able to like breathe properly. But then they're able to talk to me afterwards, and they're able to like let me know what's going on. And I think it really helps them to be able to like do it by themselves now, because like there are kids in the class like that when they see someone else sad, they'll go up to them and they'll go, and they'll like tell them to breathe, and it's the cutest thing ever, like having another kid tell them like what you've been trying to teach them. Or we have like one where like she blows out her candle, so she like holds her finger there and she like just blows it out. So yeah, that's how that was the intervention that I had implemented when dealing with self-regulation, and just allowing them to know like they can have feelings, but that they need to be able to like deal with how they're feeling. So yeah,
that's really nice.
And then, yeah, I said that like parents were responsible and like teachers, depending on like if the child goes to school or not. That like, but I feel like teachers usually have like more knowledge about stuff sometimes, but then it's like on the teachers to like tell the parents what they're doing, so then the parents can implement it at home, so that it's like a full intervention kind of thing. So yeah.
Cool. I can go next. I focused on temper tantrums. Which, I mean,
good old temper tantrums.
I did a huge project for my my senior workshop last semester, but it was all about disciplining children. But a piece of that was on temper tantrums, and it was really interesting. It kind of goes along with what you were saying, Rachel, that children need to learn how to self-regulate, and they literally, like, if you look at their brain, they, in a sense, they can't control their emotions. They don't understand their emotions, and so we need to teach them, like, it's okay to feel certain ways, how to deal with how you feel. And so temper tantrums just happen with children. Like, it's going to happen. I don't care how amazing your kid is, they'll have at least one temper tantrum. And so it was really interesting to do a little bit more research and to see what is okay and what isn't okay with temper tantrums. For a parent to think it's unreasonable for their child ever to have a temper tantrum is ridiculous. But it was interesting to see how you deal with temper tantrums. And it's funny because it was saying according to the temperament. So every child's different. So it's kind of like you need to figure out what works for them. But it's absolutely, like, everything I read, which to me is obvious, is if they're screaming and crying, spanking them or yelling at them isn't going to do anything except heighten those emotions that they're feeling. And so the best way to do is either, get down on their level and talk to them, give them a hug, listen to them, or some of the things. Sometimes if they're so upset, you either need to A, ignore them, or B, tell them they need to, like for my son, for example, if he gets really upset, I have to say, honey, I understand why you're sad, but you either need to go to your room and calm down or talk to me. And you come out when you're ready to talk to me. And it works really, really well, because if I'm just sitting there going, making him like, sometimes I just need to get out of the room, get out of wherever they're upset. And he'll come back and he'll like be breathing. And then he'll talk to me. And if he still can't, I still can't understand. I'm like, you either need to slow down or go back to your room. And it's like he goes, catches his breath, and comes back. And so being into their emotions is good, but also like Rachel's saying, showing them that you understand, that you're willing to listen, you cannot make a child feel dumb for having the emotions they do, because then they learn that those emotions aren't okay and they don't know how to deal with them. So it was really interesting to see that parents that fed into it, their children tend to have more tantrums, because they feel like they're not being heard, and they feel like you don't understand, and they don't know how to communicate with you, and you're not giving them any other way to communicate. You're showing them, you keep yelling till you're heard, like, because if you're sitting there going, just listen to me, they're like, no, you just listen to me. And so it's and I've seen that so many times. I mean, it's hard sometimes. You want to just like, but I've seen so many parents just like swat them or just yell at them, and it's like they're just gonna be quiet. You're gonna get an instantaneous result, maybe because they're scared or hurt, but they didn't learn anything. And so it's like, I feel like a lot of times the disciplining people think, oh, it worked, but did it really? Do they understand why you did what you did? And so basically, patience is huge. Like for some kid, maybe going to the room wouldn't work. Maybe it'd get them more worked up. And so you just need to keep trying new things, but be patient. The worst thing you can do is kind of honestly lower yourself to their emotional level. So I don't know. It was interesting. It made me feel good about things I'm doing, but then also made me realize like a couple other tools I can try in different situations. Because when we're in public, there's no room for him to go to. So, like,
yeah. Although, like, where you just like ignore that behavior, and you just like, they're screaming, and you just like wait till like they have that second of calm, and you're just like, oh, I love how calm you are right now, and like they may not be calm at all, but they're like quiet, and they'll just like look at you kind of like, what? I'm not, but like it calms them down, like they like have that, oh, I am calm. You think I'm calm? And
yeah, it's like every kid wants attention, and if you're not giving them the good attention, they'll give you the bad. So it's like you gotta like flip them back.
It's like they know. Like we also have some kids who like they scream and cry because they think that's how they'll get what they want, and so it's like, oh, your parents like, oh, just ignore them. Just don't feed into that behavior, because it's just like it's so much harder once they like learned that if they like scream or yell or hit you or something like that, that they'll like get what they want or they'll get your attention, and it's like, it's rough.
A lot of people think it's easier, but in the long run, you're setting yourself up for some really rough times if you do that.
It is tough when kids like if they want something and you have to be firm with them. I mean, like one of my biggest struggles is that so I have four nieces, and one of them the third one I'm so close to, and the first time I had to discipline her because she had done something she shouldn't have been doing. I had everything to get me to change my mind and not to be firm with her. Like she kept giving me a hug, kept giving me kisses, and even though her older sister's 4, her sister kept telling me, remember Sam, don't let her try to beat you. So I had to keep reminding myself, this is worth it, she needs to learn. And it was really tough. I mean, I had to explain to her, I know I have a hard time disciplining you, but because you did this, it proves that you're old enough to learn that you're not supposed to do things and that you need to be put in timeout or to learn when you're not allowed to do and what you are allowed to do. So yeah. I just need to grab my notebook really quick because I have my notes in there, so just give me a sec.
So do we want to go and share some highlights of our domain interviews we conducted? don't know. Did you guys have any highlights from your domain interviews you guys conducted? Katie, your microphone's on mute.
She's on mute. You were on mute.
I muted myself when Rachel was talking. Sorry. Oh, anyways, wait. Samantha, did you get to talk about your domain?
No.
Oh, yeah. Samantha, sorry.
You're fine.
Go for it.
You're fine. Okay, so one of the things I decided to do was about misbehaving, the domain of misbehaving, and about why children misbehave and everything. Because we talked about this in my last day of my Child 150, which is Foundations of Early Childhood class. And we talked about, like, you know, why children misbehave and then what we can avoid nowadays when we discipline our kids. And one of the things was that that our teacher talked about that really helped, because this is a lot of research that she's done, because she's a big time professor here at the school. Like, she's worked at the BYU in Provo and everything. So one of the things that she talked about was that there are strategies we can avoid when we're disciplining our children that are completely, like, out and everything. Like, we should not be doing because of the risks that can happen with it. So there's only I only managed to write down a few things when we talked about this, but some of the things she said that we can avoid is inflicting physical pain, grabbing their arms or clothing, humiliating and shaming them, using sarcasm, and then threatening them. And when I look at these, I really absolutely agree, because if you inflict physical pain on your child, that can be a huge risk, especially if they have a bruise, like a little bruise on their arm or something, and they're at preschool and they're like, oh, the teachers go, oh, what happened? They'll say, oh, my mommy hit me. And that can lead to a huge risk of, like, maybe, like, being investigated, that they'll call the police and say, like, hey, this happened. And then that can, the risk of, like, police coming and thinking that you abused your child. I feel like that is something we should definitely learn from, is that when we discipline our children, whether we're a parent or caregiver or even a teacher like you, Rachel, we should just really follow these strategies because they're really good to use. And my teacher also explained, like, and this is stuff that I've looked up as well, is the strategies we can try nowadays instead of disciplining our kids, like, you know, saying, like, well, you could have done this if you didn't do this. Like, one of the things that you said, Katie, is how using time away. I feel like that's a great strategy. Like, that really is a lot better, because using time away, I feel like, is easier than a timeout, because timeout, it just means, like, they're crying. Like, whenever I see kids in timeout, they're crying, they're not happy. But with time away, it helps them to, like, calm down and to understand, like, just to calm themselves down until they're ready to talk. It's like, you know, like, to ignore the behavior, and even redirect the child. Like, you know, try to, like, redirect what they did, like, telling them, instead of being firm with them, tell them, okay, well, we could try this. And even using logical consequences and offering encouragement, I feel like that would be really good. But, yeah, I just feel like disciplining our kids, you know, we can try better than doing the things that were more common back then, like timeout and such. Is that your son?
Yeah. Okay, say hi and then go with Daddy, okay? You're fine. You're fine. Go play with Daddy, okay? Love you. I'll see you in a few minutes. Well, a little bit.
Super cute.
Bye, bud.
How old is he?
He's 2. He's almost 3.
Aww.
He's a really fun age. I love it. He's a talker. But anyways.
Wait, so he'll be 3?
He'll be 3 in August. Yeah, and he's been kind of ahead, so he's been talking for a long time, and he's been potty trained for a year, and I mean
that sounds like one of my nieces. I think he's the same age as one of my nieces, and she's a talker too. But yeah, he was so cute.
Right, and he's my buddy. He's like, Mom's been gone too long. Where is she? Anyway. He's fun.
Okay, so now we can move on to the domain interviews that we conducted. Were there any highlights or things you want to talk about?
Okay, I'll vote, man.
Mine.
Something,
Go for it, Kate. No, you go.
I was going to say something in mine that I thought was interesting. What is that? So I interviewed. My aunt has an at-home daycare, and I used to have a daycare at home too. So it was fun getting to talk to her about issues and being able to relate. And one of the biggest things, it's kind of like you were saying earlier, Rachel, about like talking to parents about things. It's really hard to bring issues up with parents. And so something that she talked about was having to become really good at learning how not to offend parents and kind of like hinting at things. But she also said a huge thing she's realized is she'd rather offend a parent and say something than to not say anything at all. Just
That's
so they
a
won't be
great point.
offended because the children are at risk. And you know what? Like, for example, I had a little boy I watched, and I knew he was just a lot like my brother who's autistic, and I really thought he was autistic. And I was really nervous for a while, and then I finally got a feeling, it's like, you know what? They're gonna get mad, but you need to say something. And I mentioned it to him. They were offended, but then they got him tested, and he's autistic. And I just thought, well, what if I didn't say anything? How much longer would have gone? And that's she gave some examples too. And so it's better to offend. I mean, obviously you can try to do it the best way you can and not completely offend. Like, I didn't come out and say, hey, I think your son's autistic. I just said, I've noticed your son is a little further behind than some of the other kids. And I was just wondering if you've talked to his doctor about that yet, or whatever. And then later on, they're like, well, what do you think it could be? And then I kept talking to him. And so she just, she said another thing along with that too, is to be prepared to, like, I don't know, not to lecture the parents, but to make them feel heard too. You don't want to come off as, your child's doing this and you need to do this. And so it was very much like, these are some issues I have. Like, have you noticed this at home? How do you feel about this? Because no one likes to feel attacked. And so, I mean, we know that intervention is such a huge, important thing. And so it was really neat to talk to her about just talking to parents about things, and in a kind way, and letting them feel heard. And obviously they're their parent, so you don't want to come off as, I know better than you. And so I think that got to me the most.
Like, you talk to them and we'll be like, oh, so we have this problem. What are you doing? Do you see it at home? Like, and try and like to see if we can like take what they're doing at home and then like give them something that we're doing to like help it out. So it's like you feel like then just like, oh, you don't do anything. Well,
why is your child hitting other kids? Like, what do you even do? I'm just kidding.
I really wish there were more teachers that way. I mean, especially for me, because this is really okay. So when I was in the first grade, I had a really hard time paying attention, and my teacher interfered. And instead of being kind and like not being like, oh yeah, I've noticed that your daughter doesn't really pay attention, she went nuts at my parents, like telling them, you need to get her under control. You need to do this. You need to do that. And she even had the audacity to tell them, you should get her tested. Get her in the doctor's office where they'll make her pay attention. Like a really scary thing that would put me through this like thing that would make me pay attention. And my parents were at first, they kept thinking, oh, we're definitely not going to do that. But then they went to the doctors anyway, and they're like, well, what do you think? And the doctors were like, we're not going to do that to a 6-year-old girl. I mean, this teacher is nuts. I mean, I just feel like teachers, if you're going to be like that to the parents, you're going to really break their trust, and then they'll decide, oh, I don't want you to be my child's teacher. Like, they're anymore.
Yeah, I feel like if we try to communicate out of love and true concern, then it's gonna come off the right way. But if it's out of like a kind of I know it all, I know it's best kind of attitude, it's
Well-
completely different.
Personally, to me, it sounds like that teacher's just like burnt out and is just like been working too long. Not gonna lie, like because when you're actually like rested and like doing okay, you don't like come at people like that. But like if you've been working like for years,
Well, and some people should
like
never
a-
be teachers, but
yeah,
Well, that teacher was always like that. Like she was never a nice teacher. And what really sorry, I don't know if you guys say this, if you guys consider this a swear word and everything. I know some people are different, but excuse my little bit of language. But it just really pisses me off that this teacher, when I would go back and visit my elementary school, like to pick up my brother when he was still in elementary school, she acted like she was never rude to me. Like she was like, "Oh yeah, I always enjoyed having you in my class." It's like, you were a jerk to me, lady. You wanted me to be tested to make me behave, and you only made me student of the month at one time because I actually managed to pay attention. And I asked my teacher, and a lot of my teachers, my other teachers adored me. Like they knew I was different. I had some disabilities, and they were fine with it. They were like, "Oh, that's one of the cool things is that she may be different, but we can learn from her from anything." And I asked one of my teachers, I asked her, and because she's like, "Yeah, I was talking to Ms. Giannini, and she was talking to me about how she was a jerk to you, and she didn't really like you too much because she thought you couldn't pay attention. But then once she found out that you were actually, that there was something going on with you, that you have some disabilities, she said that years later, she really regrets the way she treated you." And I'm like, "Oh, okay, well, that's nice, but why can't she just actually admit that to me? Like, why can't she just go ahead and admit, sorry, I was a jerk
it can
to
be
you?"
hard. I mean, we all made mistakes. I'm sorry it happened to you, but I mean, it
Sorry to a
can be
6-year-old.
hard to.
Yeah. I mean, I forgive her and everything, but it just annoyed me whenever she was always like one of my second grade teachers saw me once and she was like, "Oh my God, you're so grown up." And she was like, and she calls the teacher over, she's like, "Jana, come here, it's Samantha Honeyinki." And she's like, "Yeah, look how much you've grown. It seems like yesterday you were this small." And in my head, I'm thinking this, "Ms. Allard, thank you so much. I love you. Ms. Giannini, shut up and leave me alone, woman. I don't want anything to do with you. You really made my life crap in first grade."
Well, at
I
least
mean,
she
I'm
learned,
sorry
right?
about my outspoken. Yeah, I'm really glad that she realizes now that, I mean, it's tough. It's tough being a grown up and teaching kids. I mean,
Well,
I'm not
hopefully,
perfect.
like she was able to deal with other kids better because of learning from you.
Hopefully, yeah. I mean, that elementary school was a really great place to go to school at because they had a lot of resources for the kids who were different. Like they had a special teacher who would help me when I needed help with my math. Like I would go there every afternoon and he was just ready to help. And he always said the reason why he chose the career he did was because he wanted to help kids who have special needs, to let them know that they are just as important as every other kid, no matter what.
Mm-hmm.
I don't know if that ties in with what we're learning about, but I feel like it kind of does.
So for my interview, I talked to 2 of my coworkers. We both worked with like 3 to 4-year-olds, 5-year-olds in there kind of thing. It was interesting to like see because everything like related back to our classroom when we were like talking about it and stuff like that. And so it's interesting to see like we're like looking at our kids that we've been like working with this last year and like seeing where they're at and like the problems and stuff that they're struggling with. And it was like, and I don't know, it kind of like helped us like look deeper into like the children that we work with each day and like allowed us to like focus on like, oh, well, we see this in like this person. And then what do we do to like help them out? Because you have to like figure out the intervention and stuff like that too. And so that was cool that way to like to be able to see like how this actually relates to like real life kind of thing. Because sometimes I'm like, what? No, like it doesn't really like relate back. But for this one, it really did, and it was cool to see what she thought and then like what I thought, kind of thing. Because we kind of like discussed how different things. So yeah, it was cool.
So it was nice to see you did a good job. How about you, Samantha?
So I like talking to my mom about this kind of stuff, about intervening with kids, because she has just such an amazing knowledge of how to help kids, like how to intervene and like the appropriate ways to do it. And especially when communicating with their parents, because my mom actually works. Well, I mean, she took a year off for this year to do a different one, but for the past couple of years, she's been working as an aide in a special day class at a K through 8 school, and it's a class of kids who are autistic, actually. And she, has to intervene sometimes when they have, like, they do, if they're like biting other people and everything. I mean, it's tough. She says it's a tough job, but that she wouldn't trade it for anything else, because she just works with these kids, even though they do things that they can't control, like biting, scratching, yelling, and everything. But one I talked about was, I asked her, have you ever had any moments in this job where you had to kind of intervene, like where you kind of give advice to their parents? And she said that she has, that usually if the kid has made great progress throughout the day, like they didn't have any tantrums or didn't manage to not bite or scratch anyone, they tell the parents, and then they tell them, we've learned some techniques with them, like ask, like this girl, she does really well, like if you encourage her, I mean, she's not able to understand it, but if you keep encouraging her and telling her good job while she's completing a puzzle, she'll get more motivated to want to do it, even though she has this disability. And the parents were like, oh yeah, we'll definitely look into that. A couple of days later, when my mom did that once, the parents came back and they're like, yeah, we've been doing it and it works really well. Like that strategy that you've been learning with her helps us as well, and we want to thank you for it. Like my mom literally, because of the fact that she intervenes and like gives advice to the parents about, telling them what their daughter or son accomplished, that they can definitely do at home and see if it works at home as well, is that at the end of the school year, the parents are always sending my mom letters, cards, gifts, thanking her for just helping them know what they can do better to help with their kids, despite the fact that they have autism. So I feel like that counts. I don't know. Intervention kind of confuses me.
No, that's awesome.
That's good.
Yeah, it's a really great thing to see those kids progress, even though it's not easy. I volunteered in my mom's class, and it's just amazing how well you can work with these kids. Like one of them because they also will attach, those kids. They will attach to you. Like one of the kids, like, became very attached to me and would not leave my side every time I volunteered. And every time I wasn't there, he would be so upset. Like my mom said one time, he showed up without me. He was like, the kid was like, hey, where's Miss Sam? And when she told him that I couldn't come because I moved, because I had just moved up here at the time, she said he had a huge temper fit about it, because he really was hoping I would be there to help him, encourage him and everything. Because this kid was very high functioning despite having autism, but there were some things he struggled with, and I would help him. I would help him practice what he was struggling with. But it's just really interesting what you can do to help intervene with kids.
That's great. Okay. So our next thing, it says, attempt to identify common elements of effective intervention targets to different problems in different domains.
I feel like that's kind of hard to understand.
So I think like a common element would be like patience with whatever intervention you're implementing. So like you're always gonna need, like when you're starting something new, you need to be on a level where like you're able to give that child like time, like and not feel rushed. Being patient with them, so like allowing them to like work through the problem they're dealing with. And I think that can really like go through all the areas.
Another one, I think, if you notice, like there's always different options, like there's not one solution, and so I think you need to be willing, like you can't be like, well, this worked for this kid, so I think you need to be willing to try new things and keep going, and be patient with yourself. If you try something that doesn't work, then you keep going. I mean, and so I think, yes, just tiny things and not give up. And then the one other thing I thought of was, you know what always said at the end of our charts that we made, kind of like who the main person was, and like she said to try not to always put the parent. But in the end, even if it's a speech therapist that helps or whatever, the parent has to acknowledge that they need help. And so the parent, it just emphasized to you how crucial it is for the parents to be involved and to be able to, when you're teaching school, you can't make a difference if the parent doesn't also implement what you're doing.
Oh,
so like that's crucial, is to reach parents. So when children have problems, like with obesity, for example, you can't tell a kid what they need to be doing. The parents need to know what they should do. If the junk food stays in the house, guess what? Like the kid's not going to go, oh, yeah, I heard in school that's not good for me. Like, you know, so parents play a role. Those are kind of.
You should also have knowledge and everything.
Yeah.
Hey, hold on a sec. I'm getting a phone call. Hold on. Hello? I'm actually in the middle of a group meeting. It's about intervention and everything. Child grade 10. So sorry about that.
Okay.
No worries.
Any other thoughts on that?
Yeah, just like I said right before that phone call happened, you really should have a knowledge, because if you're just gonna say stuff and everything, it has to be accurate and everything. Like when it comes to intervening with kids, and also just like having a firm knowledge that you know what risks can happen with like autism or obesity and such, instead of like just thinking you know everything. You should just have a definite knowledge and make sure you use it the right way to help people.
Yeah. I think that's pretty good. So what is the best thing you learned to foster optimum development?
Things like I just said, for me, it's just getting to the parents. Whether you're a parent and you need to be looking at things or creating programs just in the community to help raise awareness for parents, it's figuring out how to get to the parents so they can help their kids or know where to go to help their kids. I feel like it's kind of huge.
Yeah. Yeah, to foster optimum development, I think it really is, it has to be a full, treatment. Every, level a child's on needs to, be kind of teaching the same things, at home, at school, at, church, at, sports or whatever they're doing, having, the same kind of, guidelines, understanding there's rules, understanding, what people are expecting of you, not having too high of expectations kind of thing, and just understanding where the child's at. Every child's different, I think, is something that really I was important to me, that I learned this in this class, was that yeah. Sam?
Sorry, I'm just I have so much. I actually have to get going in a bit, actually, to be honest. So one of the things I feel like we can learn from with the intervention, I mean, I forgot what the question was. I'm so sorry. This is just great. Okay. Can you repeat the question one more time? And what the last thing was that we had to talk about?
Okay, so this is the last thing. It's what was general insight that you learned this semester from the class to foster optimum development.
I just feel like, knowing what we can expect from kids, and also what we can do to help them in this stage of their lives, early and middle childhood. What they do, why they do it, and then also how we can help them, the basic thing, and to teach them. like how we can definitely teach them throughout their lives, because when we teach kids, we're really helping them to learn and grow as they continue to develop.
Yeah, that's great. Okay, so we'll do this as our final 2 minutes. So it just says like highlight your group's conversation, include what you've learned, and like the conclusions drawn. So does anyone want to take it?
Kind of Jonathan.
Okay.
There we go. Okay, so the 2 different projects that we talked about were on helping children focus and the problem with obesity. And with each of those, we found that the most important aspect of that was parent intervention. With focusing more spending time one-on-one with them with obesity, them making sure their children are active and controlling what they eat. We also talked about misbehavior, self-regulation, and temper tantrums. And with those as well, the main focus was on parents, but with each of them, with misbehavior and self-regulation and temper tantrums, all of those, it was the importance of being patient with the children and remembering that we're all different and that we can use different tools to help them. Knowing how to talk to parents without offending them as a teacher, a child care provider, even a friend's parent is really important. But we also talked about how even when you're afraid to offend a parent when talking to them about potential issues, it's better to say something than not say anything at all, because it's really important for children to receive the intervention and the help that they need. And there's a lot of children who don't get the help they need because they're not brought to their parents' attention. It's important to make sure you reflect on the growth of a child as you're working with them, and to not get discouraged, and to be able to not be afraid to keep going. And as you look back, you'll see the growth as you keep going. We talked about patience, overall the willingness to try different things, and that parents are the main people who can help. So it's really important to get on our communities and to help parents be more aware, because we can't help our children without the parents wanting to make changes and to be able to help them. Knowledge is power, and so it's important that as parents we are reading and looking at things, going to seminars, workshops, listening to things at our children's schools, as teachers learning different ways that we can help reach parents and students. There's always new things that we can learn to be able to better help children, because every child is different and their problems are growing. So, yep, that is our summary.